played basketball and I was the best of my team, Mom.
Very good, Nick.
Mom, what has happened to
Oh
Dad?
my God, Jeff! Jeff, please, please. Come on, Jeff, don't do this to me. Nick, call the ambulance. Come on. Jeff. All over. He has seen several different specialists over 3 years with no diagnosis and no relief.
Looks like fibromyalgia.
Looks like you don't work for the house. A diagnosis with no cure and explanation is by definition not a diagnosis.
The American College of Rheumatology will disagree. There are specific diagnostic criteria.
Which this guy doesn't mean. Putting pressure in his pain helps instead of make it worse. He's got abdominal pain, severe headaches, and muscular cramps that come and go.
And he tried to kill himself. He's obviously mentally ill. Pain would be psychological.
It is not a mental illness to try to be pain-free.
Sane people don't commit suicide. Not one doctor who's seen this guy in the past 3 years has been able to find anything wrong with him. What does this tell you?
It means that they're idiots. It means that we gotta start from the beginning. Do a pain profile to rule out the psychosomatic pain. Search the house and bring me a donut.
Look, I know how it looks like, but I wasn't depressed. I did it because of the pain.
And can you tell us what were your symptoms?
I have really bad trouble about sleeping.
Does this look like quail to you? You think he has had food poisoning every day for the last 3 years?
Well, quail can be toxic. It can cause rhabdomyolysis, which would explain the pain and the elevated CPK levels.
It's not a toxic reaction, it's a psychosomatic reaction. His pain profile showed an excessive concern about his physical health, difficulty to sleep, to get out of bed.
He's not in pain because he's depressed. He's depressed because he's in pain.
Not according to the pain profile you ordered. It's not a diet issue. We should start him on antidepressants for his sake and his family's.
It's rhabdomyolysis. IV fluids, check his urine, and made a muscle biopsy.
So if he stops eating quail, will the pain go away?
If we're right, it's definitely treatable.
Oh, my arm starts to hurt.
Give him more medication.
His pressure is low. Let's put him in Trendelenburg.
We need a resuscitation card.
Chronic pain and pulmonary embolism. GOAT.
How did you know that?
You called after midnight. It has to be a heart problem. Heart only would be consistent with rhabdomyolysis, which means 13 and 4 would be singing in the rain. So it has to be his lungs as well.
Hypercoagulable state can cause pain and PE.
You think the blood clot was caused by a clotting problem? That's helpful.
What if it's a cancer syndrome like Trousseau's? Explains the blood clot, multifocal pain, lack of obvious physical signs?
And 1 in 3 years, no one's seen. Check his chest, abdomen, and pelvis for tumors.
Bone window is normal.
Checking for cancer masses in the lungs.
Thorax is clean, no tumors in the lungs.
Switching high rise to the abdomen. Wait, there, along his diaphragm.
That's not cancer. We have diagnosed the patient. There is intestinal edema and air in his blood vessels. The pain was vascular.
If it was vascular, we'd have seen uneven pulses.
His blood pressure was uneven. 13 and Cotton are doing the angioplasty.
He had hemorrhages in his fingers.
There's air in the intestine. It has to come from somewhere.
Yes.
We throw the catheter through his groin, and once in its position, the blood will start flowing.
Will the pain go away?
It will be completely ineffective and it will take the pain away. Cancel the angio.
There is air in his blood vessels. If we don't open the artery...
Where did the air come from? In rare occasions, air can come from air. Tooth mark, from when he was blowing through his IV.
The bubble air caused the PET and the cardiac arrest.
he wanted to finish the job. It's time to go home.
He's in a hyperbaric chamber. The dose of high pressure should take out the air of his blood.
We should put an eye on him. He's a suicidal patient.
Non-motor seizures. The pain started at his abdomen. Near his intestine, the first symptom has got to be key.
We have multiple EEGs, all of them clean.
What about a glycogen storage disease like McArdle's? It will explain the pain. Plus, there's plenty of muscular cells in the intestine.
Foreman is right. Go and run an ischemic forearm test.
We're going to take the blood repeatedly. If the increase of effort of your arm makes it hurt more, then it is a muscular abnormality.
If you're right about this myocardial disease, will the pain go away?
We can reduce it.
Keep squeezing the ball.
How long does he have to?
Don't you have to eat?
Don't worry about it.
I don't. These tests are the most that I can support.
So, where the pain is stronger now?
In my right arm.
The pain is just in the right arm.
Oh, what happens?
My leg!
What
It hurts!
Does it hurt your abdomen?
No, only the leg.
Oh.
Pain started in the abdomen. Now it's from his left arm to his left leg, skipping the thorax entirely. A hopping pain means it's in the brain, not in the body.
Except that the pain is in two places that connect two different regions of the brain, which means you're not using yours.
Pain hopped to one leg to another, skipping an area. That means it's central.
Or peripheral, if multiple areas have this disease.
Or consistent with a completely spotless MRI.
We can even design brain versus body. We are never going to diagnose this guy.
It's not like we can cut off his head to see if the pain goes away.
Why not? If it stays, it's in his brain. If it vanishes,
You don't care about there is 1 in 3 chances that you could kill him?
if I don't diagnose him, there is 1-on-1 chances that he killed himself.
This should numb you from your shoulders down.
The peripheral pain should be gone. My legs feel different. Better.
No pain at all?
No, but less. 4 out of 10, maybe 5.
Can't be. If whatever is causing your pain is in the brain, it'd still be like 10. In the periphery, 0.
It is. Some of the pain is gone, but not all of it. What does this mean?
Nothing explains this.
Something has to.
Unless nothing does. It used to be something. We can't find anything because whatever injury caused the original pain healed a long time ago. The only thing left is the drugs.
Opiate-induced pain.
Pain and drugs. The thread pain work by changing brain chemistry. Sometime at the point where pain receptors read painkillers a painkiller. Take him out of the drugs.
We can cure him, so we're gonna torture him.
Torture is the cure. Eventually, his body will recalibrate itself.
Injecting you with naloxone, which will knock out the opiates in your bloodstream. If we're right, your system will recalibrate in a few hours and the pain will be gone.
Hours? But I need those drugs.
Not if they're the ones causing you the pain.
Then knock me out, sedate me.
That will require drugs. We need to have your whole system clear.
Please, I'll try anything else.
That's what we're trying to stop.
It will be over soon.
Testicles.
What about them?
The answer is epilepsy.
Epilepsy doesn't cause chronic pain.
It does if it spreads in the central region of the brain and rewires pain neurons.
It would appear in an EEG.
Now if the seizure is in an area that you can see in an EEG, such as the area that controls the muscles holding the testicles. It looks like you're being kicked in the nuts, isn't it? The abdominal pain didn't start here. It started lower, isn't it?
It's everywhere.
But when it first started,
In the stomach, cramps.
gas or permanent pain, it's like your kidneys being pulled out of your throat.
Why?
Because epilepsy is treatable.